Now we'll move to the next um, inflammatory next classification of issues in the body. So these are acute inflammatory disorders. So acute inflammatory disorders is not one disease condition, it's several disease conditions, classified under the same umbrella. So acute inflammatory disorders, it's just conditions where joints could get inflamed, bones could get inflamed, their surrounding tissues could become inflamed, usually due to infections, crystals, or autoimmune reactions, So they present with pain, swellings, warmth, loss of function, the rest of it. So common acute inflammatory disorders, we have acute suppurative arthritis, that's the one for joints. So there's infection of a joint. Okay. Symptoms: there's severe pain, swelling, fever, and restricted movement. Of course, you're not able to use that joint like you used to. Acute osteomyelitis, that's like an infection of the joint, the bone and marrow. Okay. There's a lot of bone pains. The acute gouty arthritis, this one there's deposition of crystals in the joint, so it's making the joint very stiff. Okay. Monosodium urate crystals. Then acute pseudogout, that one there is deposition of what? Calcium pyrophosphate, okay, in the bone, also known as calcium pyrophosphate deposition disease. Then reactive arthritis, that one is like after infections, sterile joint inflammation. So this one there's an inflammation and is after an infection, so there's no infection in it. Even if you culture the fluid, there will be no issue and there will be no infections dictated. So present with arthritis, conjunctivitis, and urethritis, that's Reiter's syndrome. Then we have the acute rheumatoid arthritis. All right. So these are all the acute inflammatory disorders, okay, as related to orthopedics.